In Kenya, Health Right started in 2005, and we mainly focus on 4 thematic areas: reproductive, maternal, newborn and child health, HIV, violence, and mental health. Mental health has become a global health issue, and more so with changes in environment, changes in economic and social situations. We thought mental health was a big public health issue that we needed to address as an organization.
In Kenya, especially for statistics that were carried out last year, showed that mental health, especially for perinatal women in the urban informal settlement, it's about 22.8%. And to be specific, in Mathare North, we had like around 1.8% of perinatal women going through postpartum depression. One main thing that we thought of having this in the informal settlement is the fact that there are so many issues that perinatal women experience during this period of conception, pregnancy, and after.
As a county, we have a lot of strong grounds on private partnership, and we thrive on the partnership we have with other partners. And one of the main partners that we have is Health Right Kenya, who came in about 3 years ago in the mental health space. They brought a project that was very unique, we had not done, that is a maternal mental health project.
Nakumbuka nikiwa na mimba huyu mtoto, imekuja kibahati mbaya, mzee kwa nyumba amekuwa mkali, you have nobody to talk to. Nikatoka from stress nikaingia depression. I tried even abortion so many times.
Nilikuwa nimeanguka, so nilikuwa hadi natumia hizo madrugs. Nilikuwa like ni commit suicide.
Ugonjwa wa akili ni ugonjwa unaweza kuaffect mtu yoyote, haujalishi uko kiwango gani. Hata mimi mwenyewe sikuwa najua kwamba hiyo shida ya akili ina affect kila mtu. Juu hapo pia mimi nilikuja kujigundua kwamba hata mimi nilikuwa na hiyo shida ya akili.
When Health Right came in, the first thing they did was to train the healthcare workers so that at least get orientation on how to assess these clients, what to expect, and how to manage.
I went through MHGAP training. In that training, you're taught about all the mental health conditions. I was able to go through interpersonal therapy training. Basically, we were focusing on maternal depression.
So at least when you go to the NCA department, you'll find the nurse there like doing some screening for the mental health services. You go to maternity, the same thing happens. Outpatient, the clinicians there are well conversant with the mental health condition, so they can screen and they can as well prescribe, or they can even do the psychotherapy.
So after how kukuja, ndio tukaanza ku-address hizi issues in a positive manner. So mama alikuwa anakuja, unamuelewa kulingana ile training uli undergo. Kuna ile form tunatumia kuscreen ilikuwa inaitwa PHQ2. Kuna questions 2 na unamscore. So akiscore sana, huyu mama anapitia depression, so unamrefer kwa psychiatrist ili aweze kusaidika. Na kama yake iko chini, tulikuwa tunaweka kwa IPT-G sessions.
So interpersonal therapy, we used to come up with a group of 6 mothers with different challenges, but all of them, they are still undergoing depression. After that, we were able to classify their issues. Is it conflict? Is it loss? Is it role change? And out of that, we were able to take them through to understand that they are suffering from depression, and these are the causes, and this is the things that they need to do to get out of depression. But in cases where we find that this mother has got suicidal thoughts, or maybe they have had suicidal attempts, definitely they just needed to be seen by a psychologist.
We've had involvement of the CHVs who follow up these mothers, and Health Right have really been part of this. Capacity building our CHVs to be able to respond to the maternal health needs for our mothers when in their community.
We are seeing at least more than 1,000 individuals seeking services at the facility, mainly because we have community health volunteers at the community who actually refer the community members from the community to the facility and assuring them that there are services, especially like counseling or psychosocial support, being offered at the facility. We have seen women come and talk about being, free of the depressive symptoms. One of the most touching things is when you have instances when a woman tells you that if it was not for this project, I was planning to kill myself, to kill my children, I'd given up hope in life. And it has been a success, and so far we have more than 300 women who are taken through the group therapy, and about more than 3,000 who were in contact with mental health information at the community level.
we've been having challenges here and there when implementing the project.
This was a new intervention in Nairobi. It was really resource intense, which had not been projected when the project was being designed.
Na wakati unaenda kwa households, unaenda unaambia mtu, kwanza nakuuliza umeniletea nini? Changamoto yangu kubwa, sina chakula, sina kazi, sina nini. Una expect wewe ni kuongeleshe ama ni hii mambo inanisumbua kwa nyumba. Aya, saa zingine ushamuelezea vizuri akajua. Unaangalia level yake sasa ni ya umemrefer saa zingine aende hospitali, haendi.
But the other challenge was there is at the community level. We are still at a space where we have a lot of stigma and discrimination towards mental health. People don't want to come up to talk about their emotions, their moods. Africans, we are not very good in that. So one of the challenges was about stigma, acceptability, but we are yet to accept that mental illness is real and we have a challenge at the community level.
One of the main things that we've learned is health system strengthening. There's need for organizations to come in and strengthen what already the government has put in place. So we ended up using the MOH 100, which has been a referral tool at the community level used by CHVs. And this has really strengthened the referrals from the community to the facility level.
We are also seeing in terms of numbers that we're having healthcare workers at the health facility, and like previously they were not there. Previously there was 0, now we are having 2.
We've done very well because through the support of this project, our clinics became robust. We had a lot of community engagements. CHVs trained on how screening, identifying and referring, doing household visits, and specifically targeting perinatal women. We had a lot of community clinics who were doing community dialogues, a lot of community sensitization, which really improved uptake of mental health services.
Imenisaidia mpaka kucope up na maisha, kucope up na marriage. It was very difficult. I cannot accept some things unless you know.
Sidhani kama ningekuwa kwa hii dunia na huyo mtoto wangu. Health right imenisaidia sana juu ilinitia afadhali mpaka nikaona kumbe hii stress iko na dawa inapona.
Sijavunjika mikono na miguu, still I can hustle. I now know how to handle my situation in whatever way.
Personally pia wanatulipa ambapo shida zile nilikuwa naye naweza tatua, na pia kuangalia jamii at large, hata mandugu zangu, madada zangu wakati wanapitia magumu naweza kuwafunza na wanakuja kutatua hayo mambo kwa njia inayofaa na wanajikubali. Imenisaidia mimi kwanza kama Catherine. Pia kwa jamii imetusaidia sana.
Mental health is very critical when it comes to the human aspect. Clients can walk into a health facility and they don't really need much. They only need that one person they can just talk to. This healthcare person would understand them, be in their shoe, listen to them and give them advice, and the client will go home very happy.
And we are so happy because the passion that we are seeing in the CHVs, the mental health champions, it's very encouraging and we are very sure that everything is going to continue.
One of my sustainability goals in every project that comes on board is capacity. We were able to train 8 trainers, TOTs, I'm a master trainer in this, and we have 32 facilitators who are county-owned, some of them being the community health volunteers. So when you look at sustainability, we have capacity already in us.
Even as we look towards the project closure, we are happy that we have impacted the lives, we have done a lot. And hopefully that we'll be able to have more support into ensuring that we scale up this project. It's impacting a lot of lives.